got a fantastic panel today with a blend of experiences from NHS, trade bodies, national organisations and industry. And if we just start with Steve, you just say a quick hello and introduce yourself, and then we'll just go down the line, if that's okay.
Good morning, everyone. My name is Steve Bates. I'm the new Executive Chair of the Office of Life Sciences for the UK Government. It's my third day in the job, so please be kind.
So it's all Richard's fault I'm here. He nobbled me before I started. I used to be at the Bioindustry Association and used to be on the COVID vaccine task force with Kate Bingham.
Thank you. I'm Helen Dent. I'm Chief Executive of BIVDA. BIVDA is the National Trade Association for diagnostics companies, manufacturers and consultants and ancillary industries. I'm very pleased to be here today. Thank you.
Morning everyone, I'm Fiona Edwards. I'm the North Eastern Yorkshire Regional Director of NHS England. This is my beginning of my 7th month in post. My career spans 25 odd years as a Chief Exec in the NHS in providers, particularly mental health, learning disabilities, working in partnership with social care, and or latterly in the integrated care board world. So I'm delighted to be with you today.
Morning everybody, I'm Sam Allen. I'm the Chief Executive of the North Cumbria Integrated Care Board, probably a sort of a lifelong servant of the NHS, but I have also had a couple of years experience working outside of the NHS as well, in industry, so have a kind of perspective of being on the outside looking in, which was an amazing time actually. I learnt loads, but also it taught me about some of the challenges of working with us from a customer client perspective. So really great to be here.
Thanks, and good morning everyone. I'm Mandy Ridyard. I'm the business advisor to the Mayor of West Yorkshire, Tracy Brabin. I also chair the West Yorkshire Innovation Network and have an engineering company myself working in aerospace, semiconductors and medical devices.
Thanks so much. And just to reintroduce myself, I'm Anna Race. I work as the Director of Health System Engagement and Partnership at Boehringer Ingleheim. A couple of years ago, I had the opportunity to be able to transform our operating model because we recognise the need to be able to partner and collaborate more with the NHS. And so we have been doing that over the last couple of years. Some of it's gone well, we're still learning lots. And I'm really excited to be able to share some of our experiences with you today.
Awesome, thank you. So I'm going to start off with a fairly easy one for you all to get us warmed up for the conversation. So obviously I think everyone in this room is bought in to the need for NHS and industry partnerships. From your perspective, given what we heard from Jim just before and kind of your own experience of what's going on in the real world, what do you think is the biggest opportunity right now for NHS and industry partnerships? And have you got any particular examples you'd like to share? That's an open question, so anyone who feels they want to go first. What's the biggest opportunity we've got right now? Where would you place your bets?
Happy to have a go?
Yeah.
Okay, so I think that we heard Jim talking about the 3 big shifts, and I think we would probably all collectively recognise that when we can really pull together and focus in a specific way, in a specific area, we can make really big changes happen. And when I think about that, I think around moving hospital care into community, I think about treatment into prevention, I think about obviously analogue into digital. And when we think about those sorts of examples and the type of work specifically that we're trying to make on a population health level in the systems, I think that there are some quick wins to be able to be made, and equally there's some longer term pieces that we need to be able to solve. We've got examples of those, of which I'm not necessarily going to go into a lot of, multiple examples with individuals and teams from that are here today. And I do believe that we will have to learn together, and we'll have to be thinking about outcomes and success and impact at the start of the work that we do if we're really going to try and deliver on some of the biggest challenges that health systems have.
Shall I get it?
Fiona, yeah.
Yeah, well, we had a couple of clues from Jim's opening address, didn't we? So if you think about what I was really struck by his characterisation of our operating model in the NHS being a 1948 model, and the connection with the need for deploying workforce reductions and staff in the right way, and then the connection with making a digital shift. And certainly my experience, and there's a lot of work going on now. I've had experience of working in the digital shared care record space, which transforms clinical practice in terms of access to information, not only from health, but social care, residential care partnerships, certainly in the system I worked with in the southeast. And but they require absolute clarity of purpose of all the partners in joining in together, health leading with the clear timescale and kind of imperative and sense of urgency for implementing change, but fundamentally a depth of relational partnering with industry partners, internal to the NHS and the public sector system as well, and those create the conditions for those opportunities to be seized. So it's kind of digital workforce reform and really a mindset of how we live our lives now in the 21st century.
Yeah, so I think one of the biggest opportunities is harnessing the expertise of our health innovation network. So in the northeast, North Cumbria, we've got a really vibrant ecosystem, and we have huge amounts of knowledge and expertise that sits in a health innovation network. And I remember when I arrived in the north, I'm from the northeast, by the way, I don't sound like I am, but when I arrived back home in the northeast about 4 years ago, you could see all this amazing work going on, but it was like we were in silos, really. We haven't joined up the dots, and I feel like we've definitely come a long way, but we've got so much more opportunity to do more together. So having really clear innovation pathway, having really aligned priorities. So we developed our clinical condition strategy, so we're really clear and we can signal to industry and partners, these are the key conditions in our area that we want to focus on. Come and help us with those. Women's health became a big priority for us last year, so we've done a Femtech accelerator. How do we bring the sort of the vibrancy of the sector in? But equally, to Jim's point, we've just signed off our urgent emergency care plan at our board yesterday, and point of care testing in our respiratory hubs is going to be something we're going to do a test and learn on this year. And actually, if we can, through the point of care testing, our hypothesis is we could prevent then further attendances at ED, then we'll scale it next year. So I think if we can get simple business rules, really clear alignment and prioritisation so that we can signal to industry, come and work with us, and then have commissioning processes that support that. I think that's a massive opportunity. And then just finally, I was really struck by the 1948 analogy as well, and I love that saying, the system's perfectly designed to get the results it gets. And I was thinking about high street banking. So, you know, some of you may know people that work in high street banking. So their business model, they've got banks still in some high streets, but obviously they've gone online, but they have a corporate centre that does all of their product development, and then they implement it. The operational managers work to a set of standards, they're implementing things, absolutely can come up with ideas. And I think we've got to really challenge ourselves and health service about where does the product development happen, and then how connected does that then get to the front line. And if we've got over 200 individual systems and parts of systems doing everything their own way, it's no wonder we get the results we get. So I think we need to be a bit bolder on a small number of priorities that we scale and do really well for patients.
And just a thought from Helen, and then we'll go to the next question.
Thank you. So a couple of things that the lady just said a moment ago, and also what Jim mentioned. I think that certainly one of the biggest opportunities is engagement. And because of that engagement, this is from an industry perspective, so I'm obviously talk to members and companies all the time, and what is actually historically been really difficult is the ability to talk to people who are doing the jobs. And the people who are doing the jobs are the ones who are organically telling the industry what that demand is. So therefore, what we've been getting, and this is anecdotal, and one day I would really like to prove it when it quietens down a little bit, but what we're getting now is disruptive technologies that come through based on what people think the system needs. What we haven't got, and which I think we can really, really increase, is when we get what I refer to as on-demand innovation. So they understand what is needed in those situations, and that's observed, and it's understood, and it's to answer questions that people haven't realised are questions. And we're about, certainly in our industry, we're about a 10-year lag on that, because it has been so busy and difficult to do that we haven't got all of the potential innovations through that could have been delivered. So I think engagement and understanding, and I think going back to the 1948 point as well, is we have to learn how to work with each other, because there is R&D engagement, which is entirely different to the 8 weeks before procurement engagement, which is entirely different to after that in the contract engagement. And to have suppliers and companies not allowed in to see people is causing a problem massively for innovation. And with the plans, the 10-year plan, and everything that's been said today, while change is in the air, I think we should absolutely take it.
Thanks, Helen. So I'm going to come to Steve. So 3 days in, but I'm sure, like the rest of us, you have read the Life Sciences Sector Plan cover to cover.
I did. That was the Sun Lounger reading in the summer.
And obviously that is a plan that was well aligned with the 10-year health plan. It was nice to see both of those national documents with a good degree of alignment, which is critical for the optimisation of innovation. So 3 days in, what are your top priorities or hopes, and what's getting in the way?
So I thought I'd better have an initial plan, at least when you're turning up to talk. So I thought 3 letters would do it, DTC. So I think my initial plan is to focus on data. We've got immense, to answer the question before, we've got immense opportunities in data, and we've got a plan to transform that. And actually, when I talk to venture capitalists and the big companies that are interested in the UK, they're very interested in what we're doing in health data, and we can see some big investments coming there. Trials. We're fantastic at getting quality data out of trials. We need to be faster, and we need to think very cleverly about how we do that. And I'm very keen that if Jim has one thing in his plan, it's the 150-day target that's in both the NHS 10-year plan and the Life Science plan. And C is capital. And by capital, I mean money into companies, scale-up capital to get money into companies to grow. But it's also about solving some of the big problems that we're seeing with drug pricing that are causing barriers. I think the other thing we should just do is jump up and down about the successes. Richard tells us we had £500 million investment in Manchester from a health tech company this morning. Now everyone will remember MSD last week and £1 billion out of London. Well, that's 2-1. We've got one back already, right? I may not be a Geordie, but I am a Gillingham fan, and I know that we need a 1-0. One back in a week is pretty good going. And I just think we should be really confident. There's fundamentally, the world wants to come and work with the UK. Tough environment, tough global environment. But actually, we just need to celebrate this stuff a bit more. I think we need some candles, we need a cake, we need... if you've been to City Labs and seen the stuff down on the south side of Manchester, it's fantastic. I mean, that's going to be full of people working for the next 10 years as a result of this. That is what this is about.
Anyone want to build on any of that? Don't worry, I've got plenty of questions. Yeah. I was going to come to Mandy next. So Mandy, the government have reaffirmed its commitment to growth as being one of the biggest mission perhaps for the government. We heard that in Keir Starmer's speech yesterday. Could you just explain what that means from a place-based city region perspective? What is the role of place-based economic growth, and how can NHS industry partnerships contribute to that agenda?
Okay, it's quite a big question, but I'll try and summarise. So in West Yorkshire, we've had to put a local growth plan together like every other mayoral authority in the country. And within that, our clusters are absolutely key to driving that growth. I mean, the country needs growth. It's challenging at the moment for the UK, and trying to make sure that that growth comes to West Yorkshire is part of my role. One of our clusters is health tech, and we have £160 million to spend over the next 10 years on our investment zone. We already have a huge cluster of businesses here working in data, devices and diagnostics. And so building on that is important. We talked about trials earlier, and we talked about innovation. I think from a business point of view, what businesses need is the ability to trigger demand from successful trials. We spend a lot of time, or businesses tell me that we spend a lot of time in the NHS trialling things and then not getting anywhere to the next stage. So when government is putting in money into incubators and accelerators, if those successful trials don't then convert to quick demands, we are wasting money on that runway working capital. So no matter how many venture capitalists want to invest in those businesses, there is an issue with being able to stay alive. It's survival of the longevity rather than survival of the fittest. So we really need to think about that as an NHS organisation. I think the other point for driving growth is the points that were made earlier around capitalising on best practice. And in business, you know, you do that really quickly, and I think that point was made well. Where is the communication for showing off what you've done in your trust or in your area so that other people can read that? You know, a Facebook for the NHS of the things that are going well. Where do we share best practice so that everybody can learn from it? And can we do that from any level rather than just from the CEOs of the organisations? I think that's important. So in West Yorkshire, I think the important thing for us is how do we help our businesses to start up? How do we help them to scale up? And both of those things are related to that runway. And also, how do we attract more domestic and international businesses here to set up? The investment zone is part of that. The ecosystem, which we have here in West Yorkshire, is part of that. Going overseas, our health bridge with Nashville, for example, will be part of that. But all of that is down to speed to market from a business perspective, and also communication at a very noisy level.
Yeah, of course, Anna.
And I think, you know, the point's been raised about sharing best practice quite a lot, but, you know, what we don't necessarily do is we don't necessarily share about when things don't go well and learn about when things haven't gone so well. And, you know, there's very often times where something might not necessarily be deemed to be successful within a particular locality, but that doesn't mean to say that it wouldn't work somewhere else in the country. And I think as British, you know, we're not typically great at putting our hands up and saying, hey, we didn't do a particularly great job at this. We tend to celebrate success. We tend to celebrate when things go well. Maybe we need to start challenging ourselves a little bit more to be talking about when things don't.
I'm going to come to Fiona and Sam, if that's okay. So the 10-year health plan is very pro-innovation, we would say, and underlines the importance of the relationship with industry in delivery of that ambition. How is that translating at the moment down into health systems? It's still a fairly new plan, and there's a lot of complexity, as Jim outlined. So is the NHS ready to embrace this opportunity? Have we still got work to do?
So, well, I think it's a mixed picture, isn't it? And so what we're trying to do nationally is to be really clear about shifting the way the NHS, and as it develops and merges with the Department of Health and Social Care, to be much more about standards, less about trying to give direction on everything. So in the space around innovation and support, it's really important that we know, and my experience is that we know the best innovations happen where you have a climate created through very robust local place-based relationships, and a clarity of agenda for the locality, the place, clarity of agenda for the partner organisations in there that create a climate for innovation to happen. And in terms of addressing the here and now challenges that we've got across public service, in terms of all of us having to reform, meet increased demand, that the nationally, what we're up for, and you'll hear more about this from Tom Ridyard this afternoon, I'm sure, is how demonstrating the core frameworks for component parts of the NHS to operate. So being really clear about provider strength and capability and supporting developing high-performing organisations that can work autonomously and freely, and part of the test of that, and as we move into regulating for that, will be how robust and clear organisational strategies are for embracing partnerships, embracing innovation to deliver their clinical strategy goals, and then demonstrating a pattern and potential for delivery, so that that's the kind of change that we're into now, both from a national, regional and local level. I'm sure Sam can expand on that.
Yeah, so I mean, I think we need to be kind of, I'm quite a sort of pragmatist and a realist, and I think we probably all know it is tough at the moment, and I think people are finding it challenging. I think the whole geopolitical environment, never mind what we're grappling with in health. Having said that, I sense a real kind of sense of energy and optimism around actually the case for change has been made really clear. We heard that again from Jim this morning. And I think we are at a sort of a tipping point, really, when it comes to the health service, which is we've got to keep the show on the road, but we have to transform out of this. That isn't optional now for us. And when I think about the North, I think about innovation, and we often think about whether it's diagnostics or tech, and as Jim said, it means different things to different people. I think our greatest asset actually are our people, and I think we need to really double down on providing them with the opportunity to innovate and harnessing their expertise, as opposed to the daily grind of work at the moment. So it's a privilege, isn't it, for all of us to be sat here today. There are lots of people who would like to be sat in this room today, not just the ones online, but people working in ED departments, still in outpatients departments, in general practice, dealing with the 8 a.m. rush. So it is incumbent upon us to make this change. So I think there was a genuine excitement, and I was really encouraged when the Neighbourhood Health National Programme came out. We had 9 applications across the North East, North Cumbria. That was testimony, I think, to that level of optimism and motivation that still sits in people to make the change. And I think we need to harness that, but we've got to back it up with the support. We've got to back it up with the support, whether that's still finding ways to be creative with some of the money on innovation, having much simpler business rules around commercial relationships with industry, because it's probably a bit like penetrating Fort Knox, isn't it? Trying to get to a decision maker who will kind of agree to things. And even as a chief executive, I can guide and coach, but you want people to get there, but you still have to kind of go down and knock down a few doors. So I think we have got to celebrate. So bit of a shameless plug, just finally. We are doing learning and improvement in the North East, North Cumbria. If you go on to Boost, boost.org, you have the opportunity to join our learning and improvement community. We've got 18,000 members now, where we've got communities of practice, we've got lived experience of where people are improving services and learning together. And that does include failure learning as well, which is really important as part of the test for change. So I'd really encourage you all to kind of come and join us. But I think if we can unlock the optimism in people, and we can then back it up with a prioritisation of innovation, working with our health innovation networks, then we stand a chance.
Awesome. I'm going to come to the audience in a minute, so just give you a chance to think of your questions. So conversely to sort of Anna and Steve and perhaps Helen, how can the NHS be a better partner for industry? What are the things you would hope to see over the coming years?
I can start with that actually, and be very careful with the next sentence because it needs to be listened to carefully. Is that increased profit for industry does not mean increased prices for the people who are procuring the products and the innovations. I think what we need to do, and where we can support and where you can support us, is to look at taking the things that put the cost into the supply chain out. This means, because with industry, they are the third point on the triangle in sustainability. They are the economy, they are economics. Most of the innovators are SMEs, They've got local employment, they've got national insurance problems, they want to grow, but they can't. They're spending their potential profits on keeping their business afloat, which means they're not putting their own R&D reinvestment into them. So what we need to make sure that we do, or what we can do, and this is a big change into partnership, is say, what do you need to do to be around still and to still be able to continue to perform and operate in the UK, and then pay that amount of money. And that amount of money can be lower, it can even be lower than it is today, if you take some of the costs that are not required out of that system. So it's the bottom line and it's the profit increases, not the cost that increases. It sounds very basic, but the whole system isn't set up to do that. So I think that is something that would be really useful to work on, to see how you can then invest in your local suppliers by buying for the health service, as mentioned earlier.
Steve?
Okay, yeah. So I think I'd make 2 points. One is, I think and I'm trying out new material here, so tell me if I've got this entirely wrong. Because I know a couple of people in this audience, but I'm used to speaking to industry audiences. So,
well, you might get booed then.
So I hope I won't. But one of the things that I think the NHS sometimes think of is that industry is distant, i.e. it's big pharma. And big pharma is something that is away, that's sort of either in America or somewhere else. Who here in the room is paid for by industry? Put your hands up. So these are your colleagues, these are people in our communities, these are the people here, these are the jobs. Now, the scary thing is these are the jobs that can be moved to Australia. These are the jobs. Now, the NHS is not going to move that many jobs to Australia, to Spain, to America, to China. The life science industry is global. It will make choices and it will survive whether the NHS does or not. Right? That's the brutal truth of it. Now, the trick for us is to think, actually, these industry colleagues are part of the NHS community. That's how I would see it. Tell me if I get come up to me over the coffee to tell me how to get this speech better. But that's the point, that actually the option is, do we have these people working with us, with the NHS, doing this stuff, or is it going to go somewhere else? And in the world of geopolitics, where for the first time in my working life, tariffs will be imposed on pharmaceutical products, 15% by the US, on Europe. We don't yet know the position in the UK. These will drive business decisions, and we still don't know exactly on med devices and other things. So there's a whole host of uncertainty. Now, it may be that we're in a very competitive advantage because the Prime Minister's done a great job with the President, and the King's done a great job at the state dinner. We might be in a very bad place. I don't know. But actually, some of that will be driving this. So I think that's number one. These are part of our ecosystem, and we should think about it that way around. What else could the NHS do? Speed. The only other thing I say is speed. And that's my vaccine task force heritage. I mean, you know, we could move it all. I just played a very small part in putting Oxford together, AstraZeneca. And I know that we did that really, really fast. And then we did stuff in car parks and then made some big mistakes in test, track and trace, which I'm always happy to tell people about as well. But yeah, speed really matters for lots of reasons. And I think it's just understanding that. So if you get a chance and you're doing innovation, can you do it 8:40 on a Monday morning rather than Thursday afternoon?
Anna, do you have thoughts?
Yeah, I'm happy to join. So Steve's kind of stole my thunder on that one. So I was going to say, for me, it would be see us as a partner. And so, you know, what we want when we're building partnerships is, you know, we don't want to come in to work with you and, you know, build something for a couple of years, deliver it, and then walk away and see the fruits of our labour dissipate. You know, we want to see scalability, we want to see sustainability. And so at the start of the work that we're trying to do and build with you, be upfront, be candid about what it is that you're trying to achieve, how you want to measure success, so that as we're going through that partnership together, we can talk about, are we succeeding or are we failing, and we can keep ourselves on the right path or not. And I think if we're able to do that and really think at the start of the types of partnerships that we're building, how will this be sustained? How will this be commissioned as business as usual for your systems afterwards? That's where we're going to kind of really start to make the changes that we need to. So I would say see us as a partner and make sure that we have a seat around the table right at the very start of the planning.
Awesome. Any thoughts? No? Any questions from the audience? Charlotte, hello. Oh, you'll have a mic arriving. There you go, behind you.
Hi, thank you. Hi, I'm Charlotte Lewis from Mills and Reeves, so I'm a commercial lawyer. I work on both sides of the fence, so never on the same deal, obviously. But in my experience, Jim talked about almost the competitiveness, the rivalry, the jealousy, whatever that exists or can exist between NHS organisations. When I am negotiating relationships between NHS and industry, often what is described as a partnership doesn't look like a partnership on paper. And so I think it's really important that in order to talk about speed and removing red tape and that sort of thing, I think it's really important actually for your procurement and contractual documentation to describe something that is a bit more like a partnership if that is what you're intending to do. And I would just kind of, to build on the points that you've all already said, really just like to hear your thoughts around that. I think the 10-year plan does just lean into that a little bit as well, which is really helpful, but I think that there's more can be done, and I think it's about being clear about what the relationship is and being open-minded to a slightly different relationship as well.
Anyone got any thoughts on that? Yeah, Fiona, Anna?
Yeah, so I think that you touch on a point that's critical for being able to really get the best out of all partners, is that you, rather than, so I agree, and in terms of my experience and where I would like to see us get to, is that we build networks of relationships locally between component parts of the NHS and industry, build relationships before you even get into contractual, and you just explore the opportunities together, which is where the Health Innovation Networks really supports that. But that you are absolutely clear of the joint goal to which you're then getting into a legal relationship, and it's a joint goal, but the interests of all the partners are slightly different, and you look for alignment, and you have a dialogue between all the partners. And where I've seen it work incredibly well, and you can make it work, is that and what I would look from a regulatory point of view in terms of testing contractual arrangements is there clarity of each of the component roles that partners make? Has it been built through mutual respect and regard and understanding? And is the outcome really going to tangibly, everyone understands the benefit, the communities and populations and the change? But some of that stuff takes a long time to build before you actually get into the delivery side of things. And so pace is really important, but having a climate at place and locally, the investment in that takes years. And I think the North and Northeast, I come from the South, has got the best opportunity. The collaborations I can see in different places across the region, we're really set there to take advantage. But if we see the contractual bit as where we're all going to fall out over the money and who's going, you've got to really go into that eyes open and understand that there will be difficult conversations along the way as well. You can't avoid them. So that's kind of where I'm at with that.
I think Helen. Oh.
Most successful collaborations and partnerships, we say that they're built on trust, and I don't think that you gain trust at the contract negotiation.
No.
I was going to say that's exactly the point. Is you need to pick your partnerships, the ones that are going to give you the biggest benefit, and also things to avoid. It's almost like don't try and get savings out of that contract, and don't try and put penalties and KPIs into those contracts, because the minute you've got those are when you actually had the adversarial relationships, which were designed in 1948, since we're going back to that point. But partnership has to be an equal relationship, and some contracts just can't. If it's a service delivery, if it's something like that where there is something that you need to measure, it's probably not your best idea for a partnership.
Mandy.
So I think it's contractual arrangements there to protect both partners. So whether it is a big company like the NHS, if that's indeed a company, a big organisation, and a small company, it's really important that you take advice. In terms of those, I think businesses are generally grown up. I sign contracts with Airbus and Boeing directly, where I'm a small player and they're absolutely huge. So I'm used to those contractual arrangements. And I know that lots of other companies within this arena are the same, but it's making sure that we don't over-engineer contracts for things that don't need to be over-engineered, because that puts in cost that it shouldn't. So I think making sure we have light touch contracts at the right point, but the right protection at the right point is important for developing businesses. Also, growing the ecosystem. So again, in West Yorkshire, something that we're working on, and we have a great HIN here working on that with those businesses, is important to making sure we share those that thinking and help businesses that aren't as au fait with contractual obligations understand those early doors, so they don't sign up to something that then takes them under.
We have got 2 questions over here. So if you could just raise your hand, thank you.
Thank you. I'm Andy Hilton. I'm a GP and Chief Executive of Primary Care Sheffield. So the 10-year plan describes the importance of upstream interventions and prevention. Sam mentioned the National Neighbourhood Implementation Programme, and so I'm really interested in how we ensure that innovation and future interventions are focused around that upstream agenda, how we reach out and make sure that communities, particularly underserved communities, there's innovations to support their needs, rather than just focusing on perhaps downstream interventions later on in a disease process, whether that be drugs or other technology.
Thoughts, Sam?
Yeah, really good point. And great work you're doing in Sheffield as well. I know that we're looking at that. I think it's probably where most of the innovation needs to happen, actually. In some ways, we've got to ask ourselves why haven't we sorted out some of the other stuff. I think that's much more cultural than it is innovation. But, we're doing some stuff with Boehringer on chronic kidney disease, particularly around identifying patients in underserved communities. And I think, again, it comes down to what are the local priorities that have been set and harnessing the innovation and the focus around that. So, on our neighbourhood, we got 2 of the 7 onto the national programme, but actually we're going to proceed with the other 7, and we're forming local communities of practice and a real focus around that to support their learning. But I think it is about just being clear about what those priorities are and getting it aligned. Some of the really simple stuff, I think, that hasn't helped relationships with industry have been things that have happened to people where sometimes actually they haven't had some of the rigour and the formality that's been needed. They have had a relationship, they've had a trust, and then they've got their fingers really badly burnt because somebody's come in and said, you haven't followed proper governance, and then it just puts people off and they become far less risk averse when it comes to innovation. So if we can get the business rules, I know, Nick, we've done a lot of work on our intellectual property policy, so we're really clear on that. As I said, we've done our approach on working formally with commercial organisations. If we can simplify the touch points and give key points of relationships, I think we'll just stand a better chance of having more, productive relationships with industry, as opposed to perhaps some of the things that haven't gone as well in the past.
We certainly like lots of governance in the NHS, don't we?
We do, and we like lots of red tape. And
yeah.
I think, again, our job is to try and, and Fiona and I were talking about this, try and simplify this. And I think with the new operating model, we should do that. And I think for ICBs, as we go on this journey to becoming strategic commissioners, where we're going to be very focused on, my job is going to be driving the best value for the NHS pound, the best outcomes. So we've got to have the curiosity to explore why some areas are getting better results than others, and then we've got to set the specifications and expect other services to be fast followers of that and adopt that innovation. And I think we've got a real opportunity as strategic commissioners to mandate the adoption of proven technology and innovation that drives efficiencies. Because I always think that as a patient, I want to have access to the best available therapies, the best available diagnostics. And so if we've got an evidence, particularly upstream, where that's working, it's our role as commissioners to scale that.
Can I just pick up on a point you almost threw away at the end, where you sort of said not spend it on drugs because that's not prevention, with the implication that that's not prevention. I spend a lot of time, have done until this week, with the cutting edge of drug companies and biotech companies. and they think that they are producing things that will prevent disease in the future. So they're looking at cancer vaccines, and they really think that there's the potential there. Now, I don't know whether it will work, but I think we need to think about, and this is what's really hard, is how do we think now? We've talked about 1948, let's talk about 2048. If we're in China, we don't talk about the past, we talk about the future. So how do we talk about where this is going? I look at the fact that you can do polygenic risk scoring now, and that's available from a UK biotech startup to quite a large proportion off the back of fantastic NHS longitudinal data. I don't think it's that hard to bring some of that thinking into what might enable communities that you serve to stratify them into some things that would enable that to work. I don't quite know how to do it, and I'd love to come and talk to you over coffee more about how we do this, but I'm interested in how we can do that, and maybe we can link up some of the stuff that's already there with some of this. That's where I'm thinking there's opportunity, and I hope we can do over the time of the 10-year plan.
Thank you. Sir in the pink shirt, we've just got a question over here. Through a microphone. Oh, you've got it already. Well done.
Hi, thank you. Craig Wood from First Data Bank. We're a leading provider of clinical decision support across the NHS. Proud to be working with North East North Cumbria already, and also Greater Manchester. And we've just started working with the Progress team out of Manchester University. So yeah, already supporting you guys in the North. My question was around the accelerating transformation and how often there's a barrier of entry around what is a goal here. I think we all agree, sat in this room, we're focusing on the patient outcome and the clinical outcomes for patients. But once you have that conversation, it then falls back to, well, what's the return on investment? And it becomes a procurement conversation. And the narrative on the ground at the moment is, with everything going on, innovation stops because there's no money, nobody can make a decision, nobody can sign off a business case. So I think my question to the panel is, have you got any insight on how we navigate that both now? Because there's a lot of innovation partners out there waiting to work with the NHS, but they can't. And then going forward, any examples of how we can navigate that? So yeah.
Thoughts? Yeah, Mandy?
I can come to that. So I think devolution helps with some of this. It's very much a stasis at a national level. But for example, one of the companies that was mentioned earlier on Sir James's slides has been helped by both the HIN and West Yorkshire Combined Authority to make sure that they can continue on their development of their products. So I think more devolution can help with sometimes some of the stasis that we're seeing at a national level at the moment.
Sam?
I mean, we do need to be honest that people are very distracted at the moment, and we had our board meeting yesterday. Some colleagues from industry came to be with us yesterday to see that. You'd have heard us talking about our short-term priorities vis-a-vis our long-term priorities. I don't think it's quite right to say that innovation has stopped completely, and in fact, if anything, we're doing more innovation now than I think we ever have done, particularly with the investment we've had into the region, the focus around chronic kidney disease, heart health as well, and women's tech. But we are getting far more focused and specific about what our priorities are. And I think for us, it's been about drawing on the capacity of the Health Innovation Network, who are totally integrated into our functioning as an integrated care board, so that where our commissioners are focused on driving efficiencies and some more operational demands, particularly that these winter months bring them, that we're not standing still on innovation. So we are still very much open for business, and we're just putting in place a joint post with our combined authorities as well to drive this, and probably one of the most exciting areas of innovation for us in the north. And we've got the 3 national health and growth accelerator sites in West Yorkshire, South Yorkshire and North East North Cumbria. We've had £90 million inward investment to help us reduce the number of people at risk of losing their employment, and we're doing loads of innovation in that space because it's a big test and learn environment. We've got to demonstrate impact, and I really hope that we can do, but we're doing lots of innovation in that space at the moment.
Well, I'm afraid we are out of time, unfortunately. That went super fast, but thank you so much. I mean, what a great and enriching conversation. Thank you all for your insights and contributions. I think it's clear NHS and industry partnerships are absolutely mission critical, and long may that continue here in the north. So give our panel a round of applause. Thank you.